Hi, I'm Alice Crisci with Fertile Action. I was one that testified for that bill on behalf of patients and spent 3 weeks lobbying with legislators. I was much more interested in sitting down with Republicans and Democrats because we were pretty confident that Democrats were going to pass it. And I'm very, very passionate about this issue and about this topic. I did speak to Joanna Morales before we actually put this bill up for legislation and heard everything that she wanted in the bill. I spoke with Portantino about putting those things in the bill, and we have a strategy. And that strategy, we wanted this to be a 2-year bill. Portantino is a legislator, so of course he wanted to win this year. But a 2-year bill in the state of California that is completely and utterly broke is the right strategy to go about introducing any new piece of legislation right now that has a cost associated with it. And that I wanted to clarify a couple of things. That 3 cents is actually the max that it would cost, and that came from an independent auditing agency that the state of California uses anytime a health bill has any kind of financial impact. So they actually showed that it was between 0.14 cents to 3 cents, and we're working with them on following up with that analysis because we actually think we can get it to 0. Dr. Mitch Rosen out of the University of California, San Francisco, he published a paper. They did some research that actually showed that cancer patients are choosing less effective forms of treatment if they don't have access to fertility preservation. And that costs the healthcare system much more. So that's how we're showing that we can actually get this down to 0. So I just want to reassure CLRC, Livestrong, Fertile Hope, that we actually are very much interested in closing those loopholes. And like Lori said last night, society's broken. And even in the breast cancer comparison, I don't have any expectation any piece of legislation is ever going to be perfect. And a piece of legislation is going to be perfect before we actually put it up for a vote. I was one of the people who fell into a loophole with the Breast Cancer Reconstruction Act 3.5 years ago when I had breast cancer, and my insurance refused to cover it. I know many women in the state of California whose insurance refuses to cover their breast reconstruction. These are young women. So there's loopholes everywhere. I was so honored by the opportunity to talk one-on-one with legislators. I was shocked by how many were willing to sit down with me and not give me their aid, and who gave me more than 15 minutes. I was thrilled with the opportunity to start a petition because the public doesn't know that age is the #1 impact on fertility, let alone that chemotherapy and radiation, let alone other drugs that can delay the window of childbearing years, impacts a woman's fertility. So I think that as a community, we should take every opportunity to leverage what's available. And I'm very proud of the state of California for being the first to introduce a bill, and also the first to introduce a bill that they're willing to continue working through now that it's a 2-year bill. And that I just wanted to assure everyone that that actually is part of the strategy. Thank you. Oh, and one more thing. Fertile Action works to eradicate costs for these women, and we have pro bono reproductive endocrinologists across 6 states. So, and we secure medications through Faring and some specialty pharmacies. So we're able to make sure that African American women, Latina women, and Caucasian women, all women, have access to these expensive treatments because we do know that art is a luxury market and that the vast majority of Americans can't take advantage of it. Only, and in fact, actually, I just read a research study from Market Research that suggests that 75% of those facing infertility never actually can pursue reproductive technologies because of the cost disparity. Thank you.
Well, I'd like to thank our panel and all of our participants. Thank you.